When the pulp canals within the teeth become obstructed, a range of dental issues can arise. Blockages or partial obstructions in these canals can impede proper blood flow and oxygen supply to the nerves and tissues inside the tooth, resulting in pain, sensitivity, inflammation, and potential infection. In more severe cases, the complete blockage of the pulp canal may require root canal therapy to clear the obstruction and alleviate symptoms. It is crucial to attend regular dental checkups and cleanings to prevent the accumulation of debris and plaque that could potentially block the pulp canals. By maintaining the overall health of your teeth and gums, you can avoid the need for more invasive treatments down the line.